Today's Ask the Doctor segment. It's all about diabetes, and I'm joined by Dr. LaShelle Barmore. She works at Brookwood Baptist Health's Crestline Park Clinic. First of all, thank you for being here. We know so many people have a lot of questions about diabetes. If you have a call, give us a call right now, 741-9272. And we already have a caller ready for you, Doctor. Jocelyn in Birmingham. Jocelyn, what's your question?
Hi. I was diagnosed with type 2 diabetes about a year ago. My A1C then was 6.5. It is now 6.7. And I think the reason is I still drink Pepsi. I can't find anything to substitute, that Pepsi with that's good for me, because I just don't want to drink water all the time.
Yes, ma'am. Certainly that can be an issue. And as you've let us know, 6.5 is indeed the diagnostic number for type 2 diabetes. But I would encourage you that despite the addiction to regular Pepsis, that by far that's probably one of the worst things that you can be doing in regards to controlling your numbers. Unfortunately, we do have to find those other alternatives like the diet Pepsis and things of that nature. And just plain old water really is the best thing for you. So I encourage you to try your best to let that one go.
And there are a lot of alternatives in terms of sodas, diet sodas and things that taste just as sweet. It may not be the same exact thing, but go ahead and try it. We've got Gwendolyn in West End. Gwendolyn, what's your question?
Yes, ma'am. I went to the doctor today, and I want to know, what does it mean being on the borderline of being a diabetic? What all would I have to cut back or stop eating or what?
What do you do? That's an excellent question. Pre-diabetes is diagnosed at an A1C of greater than 5.7, and at that point you're right that you do need to really work very diligently at controlling your diet. The best thing to do is start to cut back on your carbohydrates, and the way that we do that is trying to get in no more than about 45 grams of carbohydrates per meal and about 15 grams of carbohydrates for snacks. That is a very strict diet, and that's the best thing that we have in regards to preventing full-blown diabetes, and exercise and weight loss is certainly a factor there as well.
I'm just curious, how many grams of carbs in a Pepsi?
Ooh, that's a good question. I want to say there's about 35 grams of carbs in one can of Pepsi, so that's pretty significant.
Yeah. So it is worth just cutting back on those things
certainly
that you can cut back on.
Certainly.
Doc, while we're waiting on another caller to come in, what are some of the things for people who maybe you have it in your family, but what are the symptoms that you might feel in yourself that you need to go check with a doctor?
Certainly. We've all been taught that frequent urination, frequent thirst, excessive weight loss, that all of those things are things to look out for, but the honest answer is that type 2 diabetes generally goes asymptomatic for quite some time. So I would really encourage, if you have some of those risk factors such as family history, or for women that have had a birth greater than 9 pounds, or individuals that were born greater than 9 pounds, those are all risk factors that you really need to follow up with your physician and make sure that you're being screened for diabetes, because a large part of it will go asymptomatic.
Okay. We have another caller, Cora in Fairfield. Cora, your question.
Yes, I was wondering, regardless to what I try and do for my diet-wise, every time I go to the doctor, like every 3 months, my A1C be up, and instead of it going down with as much insulin and as well as the pills that I take, I can't seem to get it under control.
That is a tough question, and that's certainly something that I would ask you to stay in close contact with your physician about. But I tell you that we do have great medications that are on the market, and manipulating them in such a way to get your A1C down is so important. And I encourage you just to stay the course, keep working with your physician, keep exercising, keep dieting, and make sure that you're consistent with your medication regimen. And let your doctor know what issues you're having and what's working and what's not working, because every medication isn't for everyone, but I think that we really do have great medicines that we can get those numbers to where we need them to be.
All right. Dr. Barmore, thanks for being with us.
Thank you
We
for
appreciate
having me.
it. We'll be back in just a moment.